All right, so I want to thank everybody for joining today. This is the podcast here for Balance and Birch Virtual Wellness Center. My name is Dee. I am the office manager here. And we also have,
Dr. and Ijeh, the naturopathic doctor and stuff.
all right, thank you, Anne. So we're going to go ahead and get started. This is as far as a topic that is focused on women's health. All right, so as we are talking about women's health today, we just want to open this up as this has been as far as a topic that is very, very dear to my heart. So I just wanted to go ahead and open it up to the most common misconception about women's health. And I would say when it comes to for gynecology, I think a lot of people tend to focus on this as this is just as far as a specialty you go to when you want to have a baby and not actually focusing on the aspect of there could be some other health issues that a woman would have to go and see a gynecologist for. And Anne, I don't know from your standpoint if you feel that way as well.
I definitely feel that way. And I also think that a lot of women are like the only thing they feel like I think you mentioned it beautifully. And there's other issues too that you can go to like gynecologists for women's health practitioners for, such as hormonal issues. For example, people go there when they're like having menopausal issues or just pregnancy, like Dee mentioned, but it's really important to optimize your health at every phase of your life.
Mhm.
PMS is really not normal. Sometimes it's your body's way of telling you that something is off. So in that instance, you really need to see somebody, a doctor, that can help you with that issue. And women are not prompted for some reason to go to the doctor when they're having issues like PMS. They feel like, oh, they just have to tolerate it. But that's not the case. There are people that are in place that were able to address these issues, help you through them, get you the relief that you need. So in those type of situations, I believe women should be more open and willing to go to a gynecologist or somebody that can help them
Mhm.
with these issues.
I agree. And due to as far as the pandemic, this is an area that I didn't touch on that much because I was so worried about as far as my family and I and us being okay that I didn't go to as far as a gynecologist for a little bit. I thought it was the safest way. And then when I finally went, I end up having to look at more problems and issues actually going on that I seen them, but I was so focused on other things actually going on in life. And I think as women, you really have to take the time and say, hey, I have to take care of myself. And I think the first line, or if you want to say the responses to that, is to follow up with as far as your annual visits, whether it be for as far as a pap smear or whether it's for for breast cancer or just anything for a screening or what have you, for mammograms rather, it's important. So I think that is a big factor in the stress and different things like that. Like it's so much, but all it takes is one step, I feel sometimes.
Yes. And just know that we are partners in this as as a doctor, as a healthcare practitioner, as a specialist.
Mhm.
No, they serve as your partners. So you shouldn't be afraid that, oh, they're gonna tell me something and I think a lot of it is also a lot of women feel like a lot of anxiety or they feel like
Mhm.
maybe they're gonna find out something bad and they don't want to hear it or they're not ready to address it. But really it's important to catch things, before they exacerbate or get worse. So really staying on top of it is really, really important. And just viewing it as these people are partners in your health. They're not trying to override, they're not trying to tell you what to do. You still have a choice in it. It's your body. It's really just like a tool, a guide for you to help you through your health journey.
Right. And I feel that way. And you have even helped me in my personal life, and health, journey in dealing with, like, as far as the stressors of life, hormones, just, just everything that we have to deal with when it comes, to women in general. And I think that played a part in us actually building, as far as the rapport, understanding that it is, as far as a partnership, to understand that your health is important and your doctor is there for you. I think that is the biggest thing. And I wanted to, to open up, how do you feel about women's health and when it comes to mental health?
Mental health is huge, especially right now, especially since the pandemic. I feel like that's when we really were open. I mean, it's existed for a long time, but that's when it really got spiraled right after the pandemic or the onset of the pandemic. And I feel like, especially for women, mental health is huge. And I think part of it is, as women, we're like, naturally emotional creatures. So, most of the time we tend to have, like mental health is big and we tend to like have like anxiety is big for us, depression, all the like a lot of the mental health disorders anyway. So, but it's important to note that I know there's a huge stigma sometimes in a mental health treatment. Some people feel like, oh, people are going to look at me a certain way, but you shouldn't feel like that. Like it's okay to get help. It's okay to do counseling if you need to. And I'm just going to be transparent. I've gone through counseling before. I've seen a therapist, and I think I may soon actually go back to my therapist. And there's nothing wrong with that. You shouldn't feel like if there shouldn't be. I hate this huge stigma that's on it. There shouldn't be that stigma. It's okay to get help when you need it. It's okay if you don't get it all together. It's okay if you don't get it right. So really just, follow up with a counselor, a therapist, whatever you need, or do whatever you if you like need help, do anything that you can to really just try to manage and get the mental health under control. You don't have to try to do it alone. You don't have to try to, fix it, so to say. Just really just, get help, seek the help if you need to. If you know you're struggling with it, you can't get it right. It's better to seek the help and get it before something worse happens or before it just becomes too much where you can't even grasp it anymore.
I agree, and I agree. I go to a therapist. I tell people all the time, yes, I go to a therapist. I do. And it has helped me just to learn how to cope when things arise, how to handle, how to separate things in life, your personal and business, so you can actually focus on you, or whether it is, just being like sort of a parent, or if you're just actually getting married. I mean, there are all types of things that we have to focus on as a woman. And it's basically, I don't know if you want to call it work life, balance, or just learning how to balance. So, we work for balance and birth. You have to learn how to balance things. And I think that is very important. And I just feel sometimes there is a lack of, as far as the education when it comes to women's health. Of course, we have, as far as our basics, we know a woman can have a cycle and things. We know a woman can have a baby, but what's the process of that all? What is, as far as the after effects of having a baby? How long, do these things occur? Like, I hear people say, oh, she has mommy brain. What does that mean? She's forgetful. It's just so much that's out there that I feel we need to learn more and just take the time to be very, very kind to ourselves, I think, as women, and just learn how to take care of ourselves and bodies every day.
I agree. We have to. Like we have to treat like our bodies are precious. They're ours. You
Mhm.
know, just treat it like, treat it as gold. So we
Mhm.
really need to take care of ourselves. We really need to feed ourselves. Give ourselves that treat. Do that. Like that's the one thing that we can do for ourselves. Just take care of our body.
Mhm.
Treat it like it's gold, like it's a diamond. It's rare, it's precious.
Mhm.
It's
And
important, very important.
it is important. And um as we know, there's a lot of things going on right now when it comes to as far as our government and the different laws that have been, passed as well, but it's also the mental health. Like we really have to sit back and take a deep breath, I feel, and really take things one day at a time and one task at a time and just know that our priority is being healthy overall. Our priority is making sure we seek the help. And I think a lot of times too, lack of knowing the proper resources, and there's been things that you have shared with me that I never knew. And I've been in healthcare, I've gone to college, and these are things I didn't know. And you don't have to go to college to know these things, no. But it is just the point. There is so much to learn out here, and we really have to be flexible, and patient with a lot of stuff, I feel.
We do. We really got to be patient. I know there's a lot going on. And believe me, like you wanna take charge of your health like right now at this moment. Don't wait before it's too late. Do it now, especially with everything going on. We don't know what's gonna happen. We don't know what's to come. We don't know like what changes are gonna come. So it's best that while we can, while we're here in the now, just do it. Don't hold it off. Take care of you now. Make that appointment now. Do what you gotta do now. Make that change right now.
So let me just ask you, as you being, a provider in healthcare, what would be the easiest way or information that you would say that a woman would need to stay up to date with resources? What is something that we can do?
We can make sure we are like looking to like scholarly resources or like PubMed. You can also look at there's a database called I think it's National Women's Health.
Mm-hmm.
So,
Okay.
make sure you're looking at reputable sources. And if you really need help, you can also ask your provider for any of the resources that they use. Like I have a ton. I like the natural medicine integrative journal. I like to go to the naturopathic medicine, the AAMP website. They have a lot of good resources. And a lot of the supplements I use for my patients, they tend to have really good education resources as well that I really are my go-to. So ask your doctor if you really don't know, if you really are struggling or you don't know which resources to use. And the platform I was looking for is called womenshealth.gov is one.
Okay.
Yeah, you can
Okay.
look at National Women's Health Network. That's what I was trying to look. Yeah, so those are a lot of resources. There's podcasts you can follow, such as this one. There's webinars. You can like look on social media. LinkedIn has a lot of professionals that you can reach out to.
Mm-hmm.
All of those things really help.
Okay. So staying in the know, pretty
Yeah,
much.
yes,
Ab-
and find reaching out to somebody that knows good resources or reputable resources is important. Don't, like I said, Dr. Google sometimes is not your best friend.
I do that. That's the first thing I run to. I can admit I do that. And then it's like, okay, it's time for me to go to the professionals and leave it to them. But I do
Yes.
agree with that. And I can honestly say that you've helped me through, some health issues as well. And basically, like as far as the supplements were very helpful. So I can say actually being just actually being able to seek that help from you as well has been really helpful and life changing for me as well. So I do want to thank you for that too. Um,
Oh, I appreciate it. And
I
hearing that really warms my heart. And it really
not,
just kind of what
yeah,
I'm doing at my place. And I love doing it. And
yeah.
you
And
don't
you
even
do a great job with it. I do. And I'm not just saying that because we work together. It's not that you really have. You've opened my eyes to say, okay, I need to focus on this more. I need to do this more. So it's been helpful.
thank you so much. Like I love it. And hearing you say that empowers me the more, it pushes me the more to keep doing it, keep going.
As it
Thank you.
should. It should. Um, so yeah, I just wanted us to spend some time and open up the floor and talk about this. And I think this has been very helpful. Is there anything else that you would like to add or talk about at this point?
We can also talk about, I think that I guess we mentioned a lot about advocacy, how women can advocate about their health,
Mm,
especially in our healthcare system, especially with the change of administration right now. Right now, as we just elected a new president, and with it comes, a lot of major changes, especially for our healthcare system, a
mhm,
lot of which are going to affect a lot of women.
mhm,
I want to kind of just touch on how you can advocate for yourself and advocate for your own health, especially as women, or just as an individual, as anybody, whoever you identify as. Um, because honestly, advocating for your health, that involves asking questions, seeking clarity. Don't allow the doctors to just throw a medication at you or just say, oh, this is what it is, this is your plan, just follow it. No, when they give you the plan, ask them why they're doing it. Why is this important? Why does this relate to your health? How is it going to help me? How long am I doing it for? Are there any contraindications? Is there anything I need to know about this thing that you're giving me to use? Ask questions, seek clarity. Don't be afraid. And if a doctor's making you feel afraid or you can't ask, that's a sign that you got to go to another doctor. You're not at the right doctor. But make sure you're open. You have to open up to them. And again, if you feel like you're not in an environment where you're able to do that, that is a sign for you to find another practitioner. Because
mhm,
you are supposed to be able to feel open and, be able to do these things. So do it. Don't hesitate to speak up, especially during your appointments. You have to be proactive. Do not hesitate because it's your health. You're in charge. Like I said, you want to take charge. The doctors are not in charge of your health. You are. You have to say. So make sure you are, having that voice, having the say in everything. And if you need to write down your symptoms, maybe make sure you track irregular patterns if you need to. Um, and also don't be afraid to ask the doctor what else? What else could this be? What do you think? Is there something else? Or did you look into this? And it's also okay if you need to get a second opinion. That's okay if you really feel like in your spirit or your heart something doesn't sit right, or the doctor is not moving in the direction you think he should moving, or things are just not going as well as you think. Don't be afraid to get a second opinion. Don't allow anybody to bully you into thinking that's wrong. Just do that. Do these things. Advocate for yourself, especially in the climate that we're getting into.
mhm.
That's very, very important. I don't know if you want to add anything else to that.
I just wanted to say, as being on that side of being, as far as the patient, that is very important. I've gotten very far with that when I don't take no for an answer per se. No, we can't do this. Well, explain to me why. Is there a focus point that the doctor wants, to treat you in the way that you're thinking may not be as far as the effective way? And like you say, if you can't actually talk to that doctor and they're shutting you down or everything, and you can't just, it may be time for you to look for another practitioner. And not saying that they're wrong, might not be, may just need to be more of as far as research. And don't be afraid to get a second opinion either. Don't be afraid. Um, I've had to learn that over time. Okay, just because one provider said this, maybe there is another way, to get this done. Now, of course, I don't have as far as the expertise, nor do I have as far as the doctor behind my name, but I just want to make sure that, I know that I've done as far as everything that I can do. So I would just say, like you said, and you have to be your advocate and your plan of care. Know your plan of care. And that I feel will help you along the way. But with women's health, I think we have a long way to go, but I think we are actually starting, to open up that window of, hey, there's a little more to this, or we may need, to research this a little bit more. But I think it starts with a good support system, resources, and um research at this point. But that's all I have to add. And I do want to thank you for coming today, and we sat and talked and just opened up, some dialogue. And I hope this, is helpful, to other people that may be struggling in the area or not for sure for women's health, it's okay to ask more questions and it's okay to seek help, is what I would say. Uh,
Yes, thank you all for listening. Hope this was helpful.
Thank you so much, everyone. Have a good night.
Good night.